When we were in the hospital with Joseph the first time for his seizures, the doctor came in and said that he was seeing a tendency that looked like it might be something really serious, specifically a genetic disease. And I remember Matt coming into the hospital room and saying, look, there are 14 genetic diseases that this could possibly be, and as long as it's not Batten, we're good. On March 7th, we got the phone call from our neurologist, and he told us that Joseph had tested positive for Batten. The onset of Batten's disease will look like blindness, epilepsy, Parkinson's, and Alzheimer's. But what we weren't really ready for was the next thing he said, which was he doesn't just have Batten, he has a rare form of Batten, and there is currently no research on this, and there's no clinical trial, and there's no treatment. So what you need to do now is to make end-of-life plans for Joseph.
We were told basically to give up. And as engineers, when you're tackling an unknown problem, you don't give up. That's what being an engineer is about. And we're approaching this problem the same way.
When we found out that we were being confronted with this disease, we started reaching out to people in Dallas, and within about 24 hours, we had direct email contact with Dr. Manassian.
Batten disease is a disease that strikes young children who are, till that point, very healthy, and then their brain degenerates gradually. So they develop seizures, blindness, they lose their acquired skills and language, and eventually seizures become such that they cannot be stopped by medications, and eventually they pass away.
And in Joseph's case, if not intervened, then this disease will take his life most likely before his 10th birthday.
I've been practicing pediatric neurology for 20 years, and I simply got fed up with the final conclusion of our interaction with the family that there's nothing I can do for you. And I've been working really hard to participate in the field of gene therapy, where we could potentially do something for these families and help these children. These rare diseases, like the Batten disease that Joseph suffers from, are diseases where a single gene is defective. So it's relatively simple. We need to replace one gene. There are diseases that are much more common. For example, autism, multiple sclerosis, Lou Gehrig's disease. But in those cases, many genes are missing. Once we succeed in delivering single genes and curing single gene defect disorders, we can do it for the complex diseases that affect each and every one of us. So the Josephs of the world are the ones who are going to allow us to save countless patients from really terrible diseases, such as, for example, Alzheimer's disease.
Within about 24 hours of us realizing that there was a potential hope for Joseph at UT Southwestern, we started doing the math. I mean, it's literally like 1 in 10 billion. The odds of us being here are so slim that it's like we were meant to do this. And that was really the turning point where we decided that we were going to build a foundation that was going to help other parents like us. Batten Hope is the foundation that we've started to fund the research at UT Southwestern, specifically to help other families fund their clinical trials down the road so that they can help their Joseph.
It costs several $million to get to clinical trials for these diseases and allow us to help this one child or the few children affected by this disease. This is why Batten Hope and other foundations for these rare diseases are extremely important in terms of fundraising to allow us to do the research to treat these children.
For Joseph, our hope is that he will be the first patient to go through the clinical trial under the new gene therapy program at UT Southwestern in 2018.
So on a larger scale, we want this to be better, not just for Joseph, but we want to change medicine for all rare disease diagnosis so that, as Gina mentioned, families that receive a similar diagnosis in the future have hope.